Tucker and I do live streams every Saturday and Sunday on YouTube and Instagram. So for those of you who don't know me, I am a family practice physician. I'm located in Des Moines, Iowa. So to get things started, where are you guys listening from? What city, what state, what country are you guys listening from? I just got back from the gym, showered up. What did you guys work out this morning? Anything? And no, I do not use a blow dryer in my hair. Thank you for asking. Yep, no way. That's not good for your hair. Well, at least I don't think it's good for my hair. How about that? So over the next hour or so, you'll see it slowly drying. All right. Good morning, you guys. Thank you for joining in. Miss Young is listening from, correct me if I'm wrong, I don't know, Cerritos, California. Did I say that right? Cerritos? Cerritos? Not sure. Did I say that right? Also, you guys over on Instagram, I do have a live fundraiser for rescue, rehab, and rehome. It's located in Urbandale, Iowa, not far from Des Moines, a suburb, and that is where I got my Norman Tallow, who's coming up on his Gotcha Day here in March. I said it right? Oh, good. Thank you. All right. YouTube is a little slow over here. I don't have as many people over there joining in on where they're located. Okay, so we will talk about, good morning, Lucy. Lucy is one of my blue wrenchers, my moderators over on YouTube. She is, I guess they're calling it a blue shield now. So Lucy's job went from a blue wrench to a blue shield. She's tough over there. We need moderators on YouTube. All right, so let's talk a little bit about fasting. Why do we do fasting? Good morning, Angel. What is the benefits of fasting? Do you guys fast? How about that? Are you guys fasting on a regular basis or even an intermittent basis? You know, fasting for me is basically going without food, okay? So you're not intaking food. Some people will dry fast, meaning they will not intake food and they will not intake water or liquids. Fasting can be on a daily basis where you intermittent fast and you'll fast for 18 hours and you will eat somewhere in a 6-hour time period. Intermittent fasting, that's called. Time release fasting is another way of talking about it. Some people will do 1 meal a day. That's a type of fasting. I mean, for some, going from 6 meals a day to 2 meals a day is fasting. Some people do days of fasting. Is that wrong? I don't know. I guess it would depend on what type of medical conditions people have. Fasting is something that, you know, if you're doing more than a day or two, I think you probably need to talk to your doctor and just make sure that you are good with fasting. Okay. Let's see. Michelle is listening from Oklahoma. Michelle does intermittent fasting every night for about 14 hours. So the magic time period for fasting would be somewhere over 12 to 13 hours. So 14 is a good amount of time. But maybe extending that to 16 or 18 might help you. And, you know, with your, if you have symptoms, I don't know. Maybe 14 is just that magic sweet point that you just don't eat for 14 hours. 8 of those being when you're sleeping, and then 6 of those once you wake up. So, you know, a good 14 hours, and then you consume. I think we also have to take into consideration, what are we eating during our time that we're eating? We're not fasting. What are we eating when we do that? Okay. So, but at 62, is it recommended to fast for 24 or 48 hours? I worry about muscle loss. That's a great question. One, I don't think age should be a highlight of your concern. I think society or culture or industry will tell Michelle that at 62, she's a senior citizen and over the hill. And then she gets that in her head. Now, if Michelle is eating adequate amounts of protein and fat, when she does eat, you're going to preserve muscle mass, and you're going to exercise, you're going to lift weights, so you're going to stimulate protein synthesis and, building muscle, or not causing a degradation. So again, safe for you, Michelle, has many nuances, and I would say that, you need to figure out when you do eat, what are you eating? And I'm not saying you do a 24 to 40, well, let's just say 48 hours. I think you could do a 24-hour fast every week and be fine. Maybe a 48-hour might put you behind the 8 ball. I'm not sure, because I don't know what you're consuming when you do eat, okay? If you do once a month a 3-day fast, again, I think that can be appropriate, but I don't know your medical conditions, and this is not medical advice. As a reminder, this is for information purposes only. Geraldine, sorry. I noticed that fasting for 14 to 16 hours lowers my pulse. Once I eat my meal, my pulse elevates. So anytime we eat anything, we cause inflammation, no matter what, okay? Anytime we consume something, breathe air, drink water, we cause a little bit of an inflammatory reaction. Now, that is normal, and we need it, and our body accommodates. When we eat, our body starts to work. We trigger the sympathetic nervous system. The sympathetic nervous system is your fight or flight. It increases anxiety, increases pulse rate, increases sweating, increases, I said heart rate, but it increases these things. So it doesn't sound too out of the ordinary that whenever you eat, your heart rate goes up. Whenever you're not eating, it goes down. That is a normal reaction to our body. You've eaten, you're not eating, you're calming yourself. So your parasympathetic tone is higher, okay? Natalia practices dry fasting for 40 to 42 hours. Is that a week or once a month, Natalia? Dry fasting, I've tried it. Maybe trying it in the summertime and going out and mowing lawn is probably not the most appropriate time to be doing it, but we have enough body water that would probably sustain us. I just got probably triggered by the hot sun and did not want to withstand the pain. So Natalia does 3 days once a month. So that's cool. And she says she feels awesome. Lara says, I just joined and saw Tucker. Sorry for your loss. Thank you. Yeah, it was just, here he is. Here's my Tucker. So February 16th was his anniversary date. And yeah, it's been hard. I'm glad he's on my desk. I still get to spend some time with him, and he means a lot to me. I've never in my entire life had a dog like him. And you guys may have experienced that in your lifetime too. As many dogs as I ever get, I don't know, there will never be a Tucker. Soul dog for sure. So thank you, Lara, I appreciate that. Natalia said I actually did once for a whole month. So you did 30 days dry fast or 30 days just fasting? That I'd be interested to know. Okay. Let me make sure there's no question. I'm trying to read on, if you have a question on YouTube, please put a question mark in. It's really hard to see what's a question and what's not. Nettie is listening from Australia. Nettie says Nettie only eats when they're hungry. Dog Hugga, we are talking a little bit about fasting. So are you a faster? Yeah. Let me see. I thought I missed something from Nettie. Oh, Nettie says, I might eat twice a day some days. I am tired. I think it's tired. Is it tired after I eat? Why is this? It's going to depend on what you're eating, Nettie. If you're eating 2 times a day and you're eating a bunch of carbs, carbs have sugar. They stimulate insulin release. When we eat carbs, blood sugar spikes, and then insulin is released, and insulin will drive down sugar. If your insulin is, you're releasing a whole bunch of insulin, it's going to drop that blood sugar down to maybe levels you're not used to. You might be used to a level of 90 all the time, and if you eat something, you'll spike. If you eat something and you're insulin resistant, you're pumping out a lot of insulin. It could drive that blood sugar down below what you're used to, maybe even 70, which is still normal, but you're going to feel tired or even hungry and then you want to eat again. Unfortunately, when we do eat again, we usually choose things that are high in carbs again. Then it drives up blood sugar, we spike insulin, and the insulin will drive that sugar back down. And we go through a vicious cycle of this. If we are metabolically more sensitive, we are only going to release a certain amount of insulin to take care of this certain amount of blood sugar. But over time, we become insulin resistant if we are consuming on a large, on a high basis, a lot of carbs during your day. Yeah, Geraldine, I agree. Dogs are a huge part of my life. I'm sure that people are listening right now. It's a large part of their life as well. Their family, and I wish they could last longer. And, we have, I'm one of the people where I have coulda, shoulda, wouldas when it comes to dogs because I don't want them to go. I don't want them to die. I know they die. They just die too soon. And so I'm always working at how can I preserve their life? Just like how can I preserve you guys' life longer than maybe what you expect. So it kind of gets into a thinking pattern, and I'm going to tell you my thinking pattern. When I have people say to me, Dr. Jensen, I hear what you're saying. I hear you saying that what we eat, what we consume on a regular basis could shorten our lives. But I'm just going to enjoy my life. I'm going to enjoy my life and eat whatever I want. And so in my head, what I'm hearing is you saying, you're enjoying being sick. Because that's what ends up happening. If you say, I'm just going to eat junk and eat a bunch of carbs and I'm just going to enjoy my life, I think that is a big lie. I think that is a form of self-betrayal. I don't think calling sickness a treat is healthy, okay? I think that's self-betrayal. But I hear it all the time, and that joy that they have or think they have, it's really cognitive dissonance. But in the grand scheme of things, it's their body, it's their life, and I can disagree. I'm the doctor and I'm going to be taking care of them at some point in their life because they have a disease, because they want to enjoy sickness, and that it is what it is. So with the dogs, I do the exact same thing, and I'm going to be more vigilant than I was with Tucker, with my others. And what do I mean by that? He was nearly 17 years old. I had in my eyes that this pup could have made it to 20. So there's some things that I'm going to do a little differently moving forward with my other ones. Yes, it's diet related. Yes, it's teeth related. Yes, it's whatever, other things that I can work on. That's what it's about. I can't bring back Tucker, but moving forward, I can be even more attuned to my other ones. And that's what life is about, okay? The original case says, I just want to thank you for your time. You don't have to do this, but I appreciate your time. Thanks, IronDoc. You're very welcome. And I appreciate you for being here. It means a lot. Let's see. Lucy says, I try to have my last meal around 6 p.m. and my first meal at 10 a.m. when not training. So 16 hours. Sometimes I do a 24-hour fast. Yeah, so that basically Lucy would be doing an OMAD, a 1 meal a day if she was doing a 24-hour fast. So maybe every day or every so often she's eating every day at before 6 p.m. So say 5 p.m. And the reason that is a good strategy before 6 p.m., I believe that we should only eat when it's light outside and we should not eat when it's dark outside. So we should keep our last meal of the day at 5 p.m. or less because it's starting to get dark after that, especially in the winter months. I know you would say, yeah, but in the summer it's it's light till 9 o'clock. Okay, but when do you go to bed? Are you going to bed at 10? Are you eating at 8 and going to bed at 10? Go lay down. I don't think that's healthy. Okay, I don't. But then again, what I think is healthy for me, not eating that late because I worry about my sleep, might be okay for you. You might say, I eat steak and cottage cheese before I go to bed and I feel amazing and I sleep like a baby. Don't change anything, okay? Don't change anything at all. But for those of you who eat and, like I said, it causes a little bit of an inflammatory reaction, causes a little bit of heart rate to go up, causes maybe a tiny bit of anxiety to go up, then that decreases our sleep, especially initiation of sleep. Your body's fight or flight. And you're a little warm, which you should be cool when you sleep. Your heart rate's a little higher. You could be, you could even be sweating. You could be a little anxious, whatever it might be. But you should know that about yourself, okay? So maybe what Lucy does, not eating before or after 6 o'clock is great for Lucy. But overall, I think that we should be eating when it's light outside and not when it's dark, okay? That goes for morning time as well. Let me see. Okay. Nettie says, I'm not diabetic, but are you insulin resistant? We don't know without seeing Nettie's labs on the health of Nettie, okay? Okay, here's a question, and this is purely scientific. If we put, you're talking about blood sugar, I'm assuming that I was talking about blood sugar, so whenever we eat, especially carbs, raises blood sugar. Is that the same as if we put blood sugar in an IV? So if we put glucose in an IV and it goes into the bloodstream, do you elicit an insulin response the same as you would if I consumed it in my mouth and triggered a response? And the answer overall is yes. Most of us, if you are not a carnivore, if you're not on a ketogenic diet, without saying, most people will have a early response of insulin and a later response of insulin. What I mean by that is when we consume any type of carbohydrate, if you're a normal carbohydrate eater, you're going to release what is called pre-stored insulin. It's already been made by the pancreas, by the beta cells, and it's kind of already ready to go. Now, if you've been a carnivore for a long time, a year, in 6 months, your body doesn't make preformed insulin as readily because you're not eating carbohydrates. So the body is saying, hey, I don't need to make this preformed insulin and store it up for when you're going to get it because you're not really going to eat it, okay? Now, what happens if that carnivore or really high ketogenic person eats some carbs? Well, your blood sugar could go up quickly, and if you're monitoring that, you go, oh my gosh, my steak just rose my blood sugar, or I just had a bite of potato and my blood sugar went sky high, like as in 150. That can be normal for you because you don't have preformed insulin. If you are used to eating just a little bit of carb every single day, you're going to have a little bit of insulin ready to go. And it's going to keep that blood sugar maybe at 110 instead of 150. Hopefully that makes sense. But the question was, if I inject glucose into your bloodstream via IV, will it release insulin? Absolutely. Okay. But when we ingest it, it's a little bit slower process. Also, this is a caveat, you guys. If you are insulin resistant, diabetic, obese, one of the mechanisms of when we eat something, yes, our pancreas releases insulin, but also when we eat carbs, it triggers the GLP in our body, which is, say, in our stomach. It's everywhere, but we're going to count on the GLP is like Wegovy, Ozempic, okay, blah, blah, blah. Those GLP receptors will also stimulate insulin to be released. Now, if you are insulin resistant, diabetic, and or obese, your GLP might be lower. We don't know yet. So if you're diabetic or insulin resistant or obese, you could have less GLP in your body. Less. We haven't figured that out yet, just so you know. We can speculate. But what's something we do know is the GLP, if we do have it as an obese, diabetic, insulin resistant person, the receptors might not be seeing the GLP as well. It's kind of like being insulin resistant. You're like GLP resistant. So what we go do as doctors is just give you a ton more than physiologic doses of GLP in hopes that it will trigger you to slow down your eating. So it tells your brain you're not hungry. It tells your stomach that you're full. So it's going to slow gastric emptying, stomach emptying. When we eat something, we have a normal push through that goes through our body. But if I give you high doses of GLP, it's going to actually cause the stomach not to contract as much. It's not going to dump into the small intestine as rapidly. So it's going to stay in your stomach, the food. And that fullness, because the food is still in there, is going to tell the person they're not hungry. Then I'm working on your brain and telling you you're not hungry because there's receptors up in your brain for GLP. So via those two mechanisms, we're giving you, more GLP, and we can cause problems with that. I mean, could you imagine that if you got food still sitting in your stomach for 6 hours or more, what's going to happen if you lay down? Sure, you could get reflux, right? So is reflux more common in people who are on GLPs? Absolutely. If we are causing somewhat of a paralysis, we're slowing down gastric emptying, could that cause bowel paralysis? Yes, theoretically, it could cause bowel paralysis, and that would be a negative thing. We have to remember that any medicine in our body that has been made by the industry is going to do something to a normal biologic process in our body. Never mind that GLPs have a whole bunch of other side effects that maybe doctors are not telling their patients about, okay? We might not be telling them about what type of weight loss they're experiencing. We might not talk about how a GLP can affect thyroid, or how GLP can affect our eyes, or how GLP can affect our brain. I'm not sure that doctors are talking about the particular foods that people are eating despite being on a GLP. And what happens to the fat cells with a GLP? what happens when we stop a GLP and we go back to what the person calls normal eating. They were on the GLP and they were eating a normal diet for them, but it was just less. So they lost weight. Less energy was coming in. They may not have changed what energy was coming in. They might have said, well, instead of 2 burgers, I'm eating a half a burger. Still has the bun, still has the ketchup, still has the sugar, and it still has the fries on the side, but you just didn't eat as many. That is still triggering insulin response, okay? In fact, a GLP has been known, even exogenously, if I give it to you in an injection or orally, it has been shown to be secreting insulin. We don't know that in humans yet. We didn't test it. I don't think there's a study that's tested it. So we don't know if GLPs actually stimulate insulin secretion, but you would think that the mechanism, because that's what GLPs do normally in our body, but what about at super physiologic doses? We don't know. These are all very good questions that we have to be very cautious when we're listening to people online, when they're giving you a fact and they say this is a fact. They're giving you information and they're saying this is exactly what's happening in our body, because I'm not sure that we know that. For instance, let me give you another with the GLP. I have read that GLPs could cause or increase fat cell hyperplasia. Fat cell hyperplasia, meaning when you take a GLP at super physiologic doses, you increase the number of fat cells being made. Now, not everybody has the potential to make more fat cells. White people, black people have more potential than a Southeast Asian to make more fat cells. But usually we just don't make more fat cells as we age, okay? But what if taking a GLP increased the amount of fat cells that our body can make? And what would happen if we went off the GLP? If we go off the GLP, we now cause your appetite to go gangbusters. You're going to be hungry because now you no longer have that mechanism telling you not to eat. So your appetite will be bad. And if you never learned what to eat and you stayed on the same diet protocol, you're going to go back to consuming the same foods at even higher doses. And since you have more fat cells, because the GLP over time could cause fat cell hyperplasia, many more fat cells being produced, now you are at risk of getting fatter than you were before. Make sense? When we diet normally, or when we lose weight normally, fat cells over time are shrinking. That's size of fat cells is hypertrophy. Number of fat cells is hyperplasia. So when we go on just a normal, we're going to decrease energy or decrease carbohydrates. Our fat cells, especially by decreasing carbohydrates, our fat cells are shrink. Do we get rid of them? No, we don't. Now, fat cells can die over time, yes. So over time, your fat cells could be dying and you have less of them. When these fat cells shrink down to I'm going to say normal. I don't know what normal, but let's just say a normal size fat cell. Not too big, not too small. So he's tiny because you're not feeding him carbohydrates, which would raise insulin, and insulin promotes growth of fat cells. Yeah, but doctor, I still eat some carbohydrates. Well, obviously not enough to cause fat cell growth, okay? Or what about this? What if you have a bunch of little fat cells all over your body? You might not even notice that what you were eating was diversifying itself all over your body. Okay? When women age, estrogen, when they were younger, was a great fat burner. Okay? But as they age, women lose that estrogen. They might consume the same amount of food and the exact same types of food, but they're going to get fatter in places where they had less fat. Why is that? Could be, one, because the estrogen's gone. Two, as they age, their fat cells were dying, and the fat cells that are left are in the areas where they're there no matter what, on hips, thighs, and belly and breasts. So you could see, as an aging female, those areas going up with fat. So what do you do? Because you say, oh, I can't eat any less. In fact, I am eating less. And I say, what are you eating? Oh, I eat the normal stuff. I eat bread and pasta and cereal and whatever. I eat all that. Okay, well, you have to get rid of that, okay? Because that is what's raising blood sugar, which is raising insulin, and insulin is causing the fat cells to grow. And you happen to have all your fat cells located on your belly, hips, thighs, breasts. Okay? All right. Lucy says, how about chewing gum? The sugar-free kind made with xylitol, does that also release insulin? You know, that's a good question. I've never put a CGM, a continuous glucose monitor, on my arm, chewed a piece of gum and watched to see if blood sugar spikes. Xylitol or stevia or erythritol are likely to stimulate less insulin release. I'm just going to say it like that. Most people who chew that type of gum don't chew it very long. And most people who chew xylitol gum are doing it for their teeth, to clean their teeth. Xylitol is an antibacterial. So it's a lot of people who don't have access to a toothbrush or, you know, anything like that, or mouthwash, if they're using them, will chew for, you know, 20 minutes or so with xylitol gum as a cleaning agent. Remember, you probably just ate anyway, so your blood sugar is already higher. I don't know if xylitol is going to stimulate blood sugar even more to cause even more release. I mean, it just seems like that little piece of chewing gum, I can't imagine. But again, I don't know. So, is it Mikey says, I don't know if I've ever been hungry. I think my mouth just gets bored. Or emotional. It's emotional. And I'm guessing you're talking about the gum. I'm not sure. Let's see. I must have missed. I'm hoping it's Mikey. Hopefully I'm not messing the names up here. I don't see the question, actually, where you guys are talking back and forth about the gum. So I apologize that I missed that. Yes. Fat is a cell. It absolutely is. It's a type of cell in our body. They're called fat cells, and they have lipid molecules in them. So fat cells will hold lipids, fats, and they hold other things too, like cytokine. They hold a lot of things in them. When fat cells get too big, they become resistant to taking in any more, no matter how much insulin is on board. If you force a fat cell to grow beyond it's like a balloon. If you put water into a balloon or air into a balloon, eventually it's going to pop. If a fat cell continues to grow beyond its capacity, it will start to leak. And when it leaks out fatty acids, the fat, okay? It'll leak them out. Usually insulin keeps them inside. When insulin is high, It prevents anything from leaking out. And this is why a caveat to, how do I say this? When insulin is high, fat or energy, glucose, is being pushed into the fat cell. And insulin also prevents the energy from coming out. Insulin stores things into fat cells. It stores energy in a fat cell. So people will say, how can fatty acids be present in the blood if insulin is high? Insulin pushes things into the cell and prevents things out of the cell. That is normal. So fatty acids really shouldn't be high in your blood. That high fatty acids in the blood is seen in persons who are in ketosis or on a ketogenic diet or a carnivore diet or a lion diet. That's when fatty acids are being used to make ketones, okay? And then those people are using ketones as an energy. So you wouldn't think that a obese person or a large fat cell person is eating a bunch of carbohydrates, right? Their fat cells are getting bigger and bigger and bigger because insulin is making them bigger and bigger, growing them. But eventually, they can't grow anymore in most people. And so they start leaking out their inners, cytokines, all the inflammation markers. They're also releasing fatty acids. So fatty acids are coming out, and you can measure them in your blood. A triglyceride is 3 fatty acids with a glycerol molecule. Usually, we don't just jam a triglyceride into a fat cell. We have to break that triglyceride down to the fatty acid component and the glycerol component and push that into the cell. Then once inside the fat cell, it comes back together into a triglyceride, into 3 fatty acids and a glycerol. When it comes back out of the cell, it has an enzyme that has to break it back down, and then it pops out as 3 fatty acids and a glycerol again. So it's this back and forth. So that's why if people are measuring fatty acids in their blood and they're very inflamed, something is gone wrong with the fat cell. He's gotten too big. And he basically explodes, and he explodes all of his inners, okay? Maybe more information that you wanted to know, but it's just the way our body works, okay? Anthony says there's brown and white fat. Yes, brown fat is the healthy one, and white fat is the one that builds up and breaks down slowly. Partially, okay. There is brown fat and there is white fat. When we are born, little infants have all brown fat, no white fat. Brown fat is metabolically active. It is burn all the time. And babies, because they can't shiver, they have brown fat in hopes to keep them warm, but they have a humongous surface area, and so they lose their heat to the environment, okay? Brown fat is very active. It's brown because of mitochondria. So brown fat has more mitochondria. Mitochondria are always active, burning ATP and doing the energy thing. They're energy producers, okay? Mitochondria. White fat has basically no metabolic activity, okay? It is just there. It's ho-hum. As we age, we lose brown fat. The brown fat that an adult has is placed in an area around our neck and our upper chest. Those are the areas where we call it the mediastinum. We have area of brown fat in this area right here, but we maybe don't have it on our arms and legs and belly and all of that anymore. So brown fat is active metabolically. The more brown fat you have, obviously, the more your basal metabolic rate is higher. You're burning. Whereas white fat is metabolically inactive. There is types of white fat. You got subcutaneous, just right underneath your skin fat. You got a little bit deeper subcutaneous fat, which is just underneath that. That's white fat still. We have white fat internally called visceral fat. That's white fat. Basically inactive. Now, are there ways to turn white fat to brown fat? Not completely. You can't just go from white fat to brown fat. There's not. However, you can make white fat a little more beige, a little more mitochondria. It's going to be a little more metabolically active than white fat. Beige fat and brown fat, very metabolically active. How can we do get more from white fat to beige fat? How can we get more mitochondria growing in our fat? Good question. One, some people have done studies on this. Cold water blasts. You just get into a tank of ice water. That will help not convert, I don't know if that's the word. It will allow white fat to become more metabolically active. Okay, that's one way. Another way is simply fasting. Fasting helps to convert some white fat to beige fat, more metabolically active fat. Okay, those are some things in regards to fat. When we are fasting or when we don't eat carbohydrates, our fat cells are shrinking in our body. They're shrinking down in size. Okay, if we do it slowly, our skin is able to compensate and not get saggy with weight loss. But if we have a rapid weight loss, and I have seen this in my practice, the people who go on GLPs and they'll lose, 30, 40 pounds in the first couple of months, their skin starts to sag, get wrinkly, because it was so stretched out for such long periods of time. And the diet that got them where they were at was very low in collagen and elastin promoting nutrients. All right. So their skin lacks good collagen, good elastin. And basically, when they lose all this weight very rapidly, they're not only losing muscle mass, but they're losing tissue. Okay. Could be fat. Some of it's fat. But their now skin will just hang. If we go slower on weight loss and increase collagen and elastin nutrients, i.e. eating bone broth, eating skin on animals, perhaps taking a collagen supplement, but I'm not big on that. And I don't even know if it's real. I don't know. I do not know. I stick to just eating animals which have high collagen, high elastin, as long as I'm eating head to tail. Now, if I'm only eating muscle meat, I'm getting less collagen and building blocks, okay? I need glycine. I need vitamin C. That is in the meat. Of course it is. Those are building blocks. But I think diet is a huge thing when it comes to, that's why I'd say if all of these GLP users started going to an animal-based diet or simply started, one, exercising, but two, changing their diet where they were consuming more collagen-containing things, they would have less problem with sagging skin, okay? But just granted, when you're losing all of this weight so rapidly, I'm not sure that there is hope for the sagging skin. I don't know. Okay. Anthony says, a lot of carbs, etc., build up white fat. Well, anytime we consume glucose through carbs, that's what carbs are, is glucose. Anytime we consume glucose and glucose goes up, insulin is going to be secreted. Insulin's job is to put the energy into cells, in this case, fat cells. Yes, that is white fat. Anthony says, I guess the key is to move more than you eat. Have you ever heard the slogan, you cannot outrun your fork? Because that is what you're trying to do, and you won't be able to do it. 75 to 80% of our weight loss or our problem is our diet. 20 to 25% is exercise. I don't know what your question is. Muscle loss in diabetic? I'm not sure what the question is. Good morning, Gio. Donna says, hi, not sure if you can answer this. I'm turning 57 this year. I'm finding that in the last 2 years, I have gained weight. It gained weight or gained fat? Has your diet changed? What are you consuming? At 57, you're likely postmenopausal. Your body has changed. How so? Are you holding fat in different areas? Donna, it's kind of a lot. I don't know what the specifics are, so if you want to add some more details of what I just asked. FYI, labs came back good. Again, Donna, your definition of good and my definition of good might be totally different. So I can almost guarantee you that if somebody were to send me adequate amounts of labs, I would find something that is not so good. Okay. Gio says keto and fasting. Yes, I think you're talking about the fat, changing fat from white fat to beige fat. Exactly. Yeah. And you're right, Gio. A ton of health issues are tied to what we consume. Like I said, we can't stop breathing air and drinking water, although we can filter our water and we can, try to consume as clean of air as possible. Do we want to live in the city? No. Do we want to live on a farm? No. Do we want to live in between? That might be the best choice when we're trying to find a place to live. The air is going to be cleaner in the in-between. I'm not going to live in city proper and have diesel fumes all around me. I'm also not going to live on a farm where there's nowhere to block whatever people are spraying and chemicals that are in the air. I'm going to avoid that. So, but I have the luxury of being able to do that. Rural area. Let's see. Did I miss any questions over here? This is a good time to maybe break in and say, if you guys like this content, if you could like, subscribe, comment, send it to people, share it. If it's important to you, it might be important to somebody else. You don't even know who it's important to, okay? So like, subscribe. If you're on YouTube, it's a subscribe, and like and follow. That's Instagram. Follow these areas. I'm also on Rumble at IronLadyDoc. I'm on X at IronLadyDoc. I'm on Threads at IronLadyDoc. The only one that's really off, and it was because it was the first one I started, is Facebook. I'm Center Stage Primary Care. That's the name of my business, Center Stage Primary Care on Facebook. So if you guys could go over to those places, like, subscribe, put a comment, help this channel go. Let's see. I'm trying to find the questions, you guys. Lucy's helping me out a little bit. Let me see. Michelle says, thanks for the live this morning. I got a lot out of it and we'll be donating to your fundraiser. Thank you. Yeah, Rescue Rehab Rehome. That's the name. That's where I got my tallow. I appreciate that. Here's a question. Does everybody need their insulin level checked? I think yes. I think everybody should get a baseline. What is a optimal insulin level? Between 3 and 5. What does the reference range tell you on your insulin level labs? They will tell you that you could go up to 22 or 23 or even 25 and still be what they consider normal. It's not normal. That is, if you have an insulin level over 5, 6, 10, you're insulin resistant. Okay? You're insulin resistant. You could say mild, moderate, or severe insulin resistant, but you're insulin resistant. Insulin, getting a baseline helps people out. Now, granted, it's going to depend on when you check your insulin level. Insulin is not static in our body. It is up and down throughout the day. So we need to be consistent when you check your insulin level. Check it at the exact same time every single time. I would say checking it around 10 or 11 a.m. would be optimal, but just be consistent. What is too low for insulin? 0. That is too low. You would be a type 1 diabetic. We need insulin or we would die. We need insulin. A type 1 diabetic would die without insulin, okay? A 0, if we're at a level of 1, Lara, we need to be cautious. It is possible for people to be right on the edge of being what I would call, a late onset type of diabetic, okay? And if I saw an insulin level that was below 2, and let's just say it's 1. If I saw an insulin level at 1, that would trigger me to order diabetes antibodies on you, okay? Like a GAD antibody. There's 5 of them. I would definitely check those 5 antibodies because you could be displaying a version of type 1 diabetes. And I would want to know, okay? That would tell me that we need to preserve your insulin, your beta cells as best we can, okay? So knowing these things, your doctor might not know them. I don't know. Your doctor for sure doesn't even want to check your insulin level, I mean, to be honest. So a lot of you are having to go to people like me and order your labs for you because, yes, I do get a little bit of a discount. Some of you are very good at finding labs that are cost effective. But some of you say, you know what, Dr. Jensen, please just order my labs and, it's so much easier. And I've actually had people compare the prices I get with the prices they get at their lab. So, I want you to save money. I don't want you to spend your money. I don't, okay? But if you can't get your doctor to order your labs, just email me at IronLadyDoc@AOL.com. IronLadyDoc, DOC @AOL.com. And I can order whatever labs you want me to order, okay? No, your insurance will not cover them. There are people who have an HSA, health savings account, and they use that credit card to pay for their labs in hopes that they will get them, because it is medically related, in hopes that they'll get them paid for. So that's an option, is using your HSA, okay? All right, so email me if you want your labs checked. What else was that? I was going to tell you about the elevated insulin levels. When our insulin levels so the question was, what's too low? Now the question is, what happens when it's too high? Yes, we've already talked about it. We get obese. When insulin is too high, anything really over 10 is starting to really cause a problem. But the goal is between 3 and 5. Keep that in mind, okay? If it's starting to get elevated, we get obese, we are at high risk for MI, a myocardial infarction, a heart attack. On the list of the number 1 cause of coronary artery disease, a heart attack, it's diabetes or insulin resistance, otherwise known as elevated toxic levels of glucose, elevating insulin. Both of those things are inflammatory and damaging to the artery lining. Over time, you're building up plaque. Has nothing, in my opinion, has very little to do with LDL. LDL is like way down the list as a cause of coronary artery disease. So high insulin is damaging the inner lining of your arteries. It's also damaging, or sugar is also damaging to the inner lining of the coronary arteries. So you're at risk with high insulin levels of having a stroke, having a heart attack. So a brain attack and a heart attack, MI and stroke. You're at risk of developing polycystic ovarian syndrome, PCOS. You're at high risk of developing fibroids, females. You're at high risk of developing dementias or cognitive decline, brain fog. You're at high risk of developing cancer. You're at high risk of having joint pain because of all the inflammation. You're at high risk of having skin complaints. Every system in your body is affected by too high of insulin. For men, you're at high risk of lowering your testosterone. And I had 3 really good videos reels that I had on YouTube, Instagram, Facebook, and I think it garnered a lot of attention, okay? But it wasn't so much on insulin. It might have been more on stress, elevating cortisol, elevating blood sugar, elevating insulin, and lowering your testosterone, okay? Go check those out. Yeah, Gio, I agree with you there on that question. Oh, thank you, Gio, for that. I appreciate that. Gio sent a super chat, and Gio says, "Hey, Doc, why does my wife have irregular periods?" Irregular as in heavy, or irregular? Do you mean irregular as in 1 month she'll have a period every 10 days, 1 month it'll be 35 days? Is that what you mean by irregular? That's what I'm assuming you're saying, is the periods are just all over the place. 1 month it's 20 days in between, another month it could be 35 days in between, or people are having multiple. This needs to, gee, I don't know how old your wife is, but it needs to be looked into, okay? Your wife could have a gynecological problem. She could have fibroids. She could have endometriosis. She could even have irritable bowel syndrome causing problems with her irregular periods. What are some other causes? Especially with women who have heavy periods and crampy periods. That throws me a red flag that says something about this woman. Like maybe, just maybe, she's got some problems with iron overload, and her body senses that her iron in her body is high, too high. We need iron, just not so much. We need insulin, just not so much. So a body that is having heavy periods every month and crampy abdomen and crampy uterus could be because the body is trying to rid the excess iron, okay? I believe that the human population in modern day is overloaded with iron. It's overloaded with heavy metals. It's overloaded with chemicals, glyphosate, whatever it is, because we live in modern society. But iron, it's a special breed. It's in everything. And processed, anything that is fortified, a multivitamin is fortified with iron, because industry, not society, industry told us that we're iron deficient, when in reality, it's doubtful that we're iron deficient unless you have a gunshot wound or you've been in an automobile accident and you're bleeding out. Then I would say you have a high risk for iron deficiency. You're losing blood, okay? How does somebody get iron deficient and not have one of those 2 emergencies? I believe it's not really iron deficiency. It's iron dysregulation. For that female who's having problems, Gio's wife is having problems with her periods, could be simply because she's got an iron dysregulation problem. She could have insulin resistance problem. She could have fibroids. She could have irritable bowel, which is likely due to consuming carbohydrates in excess. Gio should maybe have his wife go do a trial, an elimination diet of all carbohydrates. Go slow. I don't know what her medical history is. I don't know if she's got a gallbladder. There's so many questions, Gio, and maybe having a consult would help go through all of her health concerns, go review her medicines, review her diet, her exercise routine. I'm not here to replace your doctor. I'm actually here to help you and your doctor have better communication. I'm like your doctor coach. I'm not giving you medical advice. I'm giving you information. I'm going to try to give you a game plan in order to talk to your doctor. Many of you listening don't want to go to the doctor, and you use all online doctors, which is fine as long as you're getting the care you need. Now, if you have your finger cut off, I would suggest that you go to the doctor and get it stitched back on if that's possible. So there is a time and a place for doctor. But overall, my mantra is put me out of business. That would mean none of you need doctors unless you have an emergency. Okay? I think more of you guys worry more about what your financial advisor is doing with your money than what your doctor is doing with your health. You will put all of your chips into a doctor, and they're giving you advice, and you just accept it wholeheartedly without questioning them. But yet, if it came to your money, you go, hey, wait, financial advisor, what are you doing here? Explain it to me. Can you help me understand why you put it here and not here this time? Or here and not there this time? Or why do you put it some here, some here, some here, some here? Why? Tell me, share with me. Whereas if your doctor says blah, 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 you just go, whatever you say, doctor. You're so smart and intelligent, and whatever you say goes, and why would you want to hurt me? Well, maybe they don't want to hurt you, but maybe their own ignorance, it's called ignorosis, a condition of ignorance, is preventing them teaching you anything, and they just don't know. Ignorosis, they don't know. I was one of them, and now I'm changing that. I'm going to read every day. I'm going to listen to other doctors and other healthcare providers online. It's the only way I can get anything that's outside of industry. If I do CME, continuing medical education, which I have to do in order to maintain my license, which I do, all of the CME is sponsored by an industry. That industry is either food or pharma, which is both. It's the same. It's one and the same. So if all of my continuing medical education is the exact same thing that I got in medical school and the exact same thing I got in residency, I never take my blinders off. So I have to remove the blinders, jump out of the matrix, and learn something that we was never taught. That's you guys too. You and I are on a journey together to learn new things. And it is hard because we have cognitive dissonance. We were taught so many things, such with blinders on. And if we hear something outside of the blinders, they compete. This answer over here does not compete what's in here. And so they are butting heads. That is cognitive dissonance. I don't want to believe anything out here because I've been taught all of this all of the time. It's got to be right. How could so many people be talking about the narrow blinders? It has to be right, or maybe not, which I'm finding out. So we have to jump outside the matrix and start entering in things that, yes, they're going to butt heads, but butting heads gets me to open up my brain a little bit, my eyes, and start using my thinker. And that's what you guys are doing. So we're on this journey together. I just like to read stuff and supply you guys with more stuff to learn. I love doing that. I love, even if I'm wrong, even if I'm completely wrong about what I've said today, you have opened up your eyes and your ears and you're going to dig in. So I was listening to a doctor this morning, who said this. And when they get so matter of fact and they state something and they say it so matter of fact, I get these red flags popping up in my head. It's called my BS meter. It's called the BS meter. And the BS meter goes from here to here really, really fast. Okay? And I go, I got to look that up. So one of the things that I looked up this morning is the difference between meat, whether it's grain-fed or pasture, or out in the pasture, not grain-fed. So is it grain-fed or is it range-fed? I can't even think of the term. Anyway, he was talking about the different types of fat in that particular grass-fed versus grain-fed animal. And when we think about eating an animal, we actually think about eating all saturated fat. Why? Because industry has told us that animals have saturated fat and things that outside that don't have saturated fat. And that, you guys, is a big lie. A big lie. In fact, coconut has more saturated fat than a cow. Avocado, I believe, has more saturated fat than a cow. All animals have all types of fat. They have polyunsaturated fat, they have saturated fat, and they have monounsaturated fat. There isn't, I don't think, I'm gonna do one of these. There isn't anything we eat that only has one type of fat, okay? They're going to have a combination. Now, if you're looking at a grain-fed animal, is that grain-fed animal in your meat is going to have more fat, right? Because, think it through, it's going to have more fat, whereas a grass-fed animal is going to be leaner, right? And we can picture that. The grain-fed animal is fed grain, which is sugar, which spikes insulin, which drives fat into the cells, muscle cells, fat cells, all of it. That's why you are consuming what I consider like Wagyu beef. If we have high sugars, high glucose, high insulin, our muscles are like Wagyu beef. We have fat wrapped up in our muscles, wrapped up in our heart, wrapped up around our organs. So a grain-fed animal is going to be higher in fat content, correct? Okay? And that fat could be higher in omega-6 because of the grain, because of that particular polyunsaturated fatty acid. A grain-fed cow has more omega-6 than omega-3. The grass-fed animal is higher in omega-3 and less in omega-6. We need both. But we, as a population in modern day, are eating way too much omega-6 and not enough omega-3. We should have in our body of polyunsaturated fat, 3 and 6, those are polyunsaturated fats, we should have a 1-to-1 ratio. It would be too simplistic to tell you that omega-3s are anti-inflammatory and omega-6 are inflammatory. That would be a reductionist point of view. However, to get you guys to understand that when we are too high in omega-6, we should be 1-to-1. Our average population is sitting between around 20 of 6 to 3s. So we have a 20-to-1 ratio of omega-6 to omega-3. Our body is completely inflamed and sick when we have that type of ratio over time. Make sense? So is it in our best interest to get rid of processed foods, which are high in polyunsaturated omega-6? Anything that comes in a box or a bag, it is full of processed food, which has added seed oils. Seed oils are omega-6. Sunflower, safflower, soy, cottonseed, canola, corn, rice bran, grapeseed, palm oil. Those are seed oils. And seed oils are omega-6, high in alpha-linoleic acid. And we consume all of those types of foods with those types of omega-6, and we get problems, okay? We are a very inflamed population. There are some influencers, whether they be doctors or whatever their title is, believe that polyunsaturated fatty acids are the cause of insulin resistance. I think they're an added cause, a compounding of a cause of insulin resistance. But insulin resistance is hyperinsulinemia. So whatever elevates insulin can promote insulin resistance. So could it be polyunsaturated fatty acids? Could it be high glucose? Could it be high iron? Could it be every other heavy metal that we're breathing in the air? Could it be plastics? Could it be diesel fumes? Could it be burning wood? All of these things cause problems with our cells. The cells, so we have person, and then we have tissue, and then we have organs, and then we have cells, and we break it down, and then we go inside the cell, and then we have organelles inside the cells. Everything, you could say this, a reductionist way is every disease is cellular, right? I mean, you could easily say that. That could be the best reductionist ways. If your cells are a mess, you're going to have chronic disease. There are some doctors that go even deeper and say, it's not just the cell, it's actually the mitochondria. So if you have poorly functioning mitochondria, you definitely got a disease. Okay, whether it be diabetes, heart disease, lung disease, cognitive disease, whatever it is. Okay. Let's see. So Gio says his wife is 37. They're irregular. Doctors say she's fine. Well, is she fine? Has she looked into other things? Dial Up says, anyone see RFK on Rogan? Is that recently that you saw this? He mentioned, so RFK, he mentioned a way to incentivize nutrition and preventative health care. Sounds interesting. That does sound interesting. And I think that we have actually been trying to do this for a lot of years. Not the way whatever you heard RFK say on Rogan, but let me give you an example of how doctors have looked at this. This is an incentive to incentivize preventative health care. Ways that the modern medical system has incentivized preventative health care is to pay for your wellness exam every year. So your employer gets points or whatever by encouraging you to get a wellness exam. And then you could get points. You get a gift card, or your insurance goes down by a certain amount of dollars or whatever. That is an incentive for you about preventative health care. Now, what about doctors? Are doctors incentivized? We've tried this for years. We've tried to incentivize doctors. How do we do that? We tell them that if cholesterol, LDL, is over 130, they need to be on a statin. And if you have 49% of your population, or whatever that percentage is, who have high cholesterol and they're on a statin, you get money. Doctor, that's an incentive for you to practice what they consider. See, who's defining preventative medicine, right? So basically the doctors are saying, I'm going to get your blood pressure to goal. Who did the goal? Who knows, right? But I'm going to get there because it's a guideline. If I follow it, I get a bonus. And you get a bonus from your insurance company or whatnot because you're the buyer of their insurance policy. So that has been going on for decades, where we try to incentivize people to be preventative. But we've skirted around the actual idea of let's look into your nutrition. But even if we did, and even with today's food pyramid, we have such cognitive dissonance as doctors that we're not going to talk to you about eating steak. We're going to talk to you about eating whole foods. Well, oatmeal is a whole food, you're going to say, and a plant is a whole food in general. So who cares if the plant made a goldfish or if the plant made a steel-cut oat? The doctors are not going to talk to you about that. So I'm not trying to bust your bubble here, but RFK or whoever, let's just don't even give it a name. If whoever says, oh, we're going to incentivize people to get healthy, we've tried that. We've tried to incentivize. We've opened a gym on every corner to incentivize people. We've got food everywhere you look to incentivize people to eat fruits and vegetables because they've been told they're healthy. We have the disincentivized problem, okay? Meaning we have so much of the other and people are so addicted. The real definition of addiction is really just having no control whatsoever. There's no control. If you're addicted, you have absolutely no control. And I didn't say how you got addicted, okay? But I'm just saying it's a lack of control is what addiction is. Oh, doctor, you shouldn't say that because I try and try, but you still don't have control. It's maybe not your fault. Somebody gave you the drug, you were sleeping, they injected it into you, and now you're addicted. Or you just say, I'm just going to try it one time. Well, your brain got fed, and now it's addicted. So you lack control. They did that to you, probably, right? Oh, this Dorito's not going to hurt you. Just eat the Dorito. It won't hurt you. Just have one. Oh, but they're so good. I'm just going to have two. Oh, they're so good. I'm going to have three. And then I need to have something sweet with it. I remember when I was a kid, we would have people, I heard that, nothing I did, but people would have popcorn for supper. And they would salt their popcorn, maybe even butter their popcorn or put oil on it or whatever they did. And then they would throw in a bag of M&Ms. You guys ever done this? So they got a little bit of salt and they got a little bit of sweet. And we called that healthy because they weren't eating anything bad for themselves, be it for supper or whatever meal it was. Oh, I only ate popcorn. Well, okay, that is healthy. Where was the nutritional value? And then when we get down to it, they had popcorn, salt, and sweet. And so you know how they made those candies that are a little bit of salt and a little bit of sweet. Now you got a Snicker bar, right? Let's see. Yeah, Norman says stay out of the medical system, and maybe that's what people need to do, and maybe that's what I'm encouraging you, unless you need a doctor for a reason. But when you're in the medical system, you need to picture this. Anytime you go to the doctor, I'm not telling you not to go to the doctor. You can go to the doctor if you want. That's an industry, and they'll never go out of business because there's a lot of sick people that find joy in being sick. They love being sick. Well, no, they don't. Doctor, that's wrong too. Well, it is, because if you know what's causing you to be sick and you continue to do it, then you find joy in being sick. You want a treat. And you find that the treat is okay, but yet it's making you sick. these are the things that I find just mind-boggling, but I don't even know where I was going with that. Norman says, have you ever looked at the menu that the hospitals serve? I have. I mean, I worked a lot of years in the hospital. I ate the hospital food. I do know that you can order off the meal. I know because I've done it for my mom. So when I plan her meals that came to her room, I say she can have a chicken breast, she can have a vegetable, and she can have cottage cheese. She can have hamburger patties, bring 2, and some cottage cheese on the side, and she can have some vegetables. That is what you can do outside. If you tell them not to bring a bun, they will not bring a bun. If you tell them not to bring fruit, they will not bring fruit. If you tell them not to bring a juice, they will not bring a juice. No pop, no pop. But if you don't tell them, they are going to bring what is on the hospital protocol, the jail protocol, the school protocol. It's all written by the same industry, you guys. And until you figure that out, they have no idea. Do you think that the nurses or the people, the servers bringing up your food to your room have any idea what food is about? No. You're giving them way too much credit. You think that they're poisoning you? They have no idea they're poisoning you. They just make what the thing is and they bring it to your room. The nurses, they don't know. Look at the nurses. I don't know if there's any nurses. I'm sorry if I said something that was derogatory, but look at the doctors. I am a doctor, but look at them. Look at them. Look at their body. Look at their skin on their face. Look at their body habitus. Look at their muscle mass. Look at their fat mass. Look at their teeth. Look how they breathe. You guys, we are a sick bunch. And just because you're a doctor or you're a nurse means nothing, okay? Being sick, it doesn't discriminate. So we need to learn to stay out of the hospital, okay? And yeah, it could be processed food, but I'm trying to pick the least processed for my mom. So the chicken breast is the least processed, or the fake hamburger that they're giving her, but it's better than the seed oil laden everything else that is on there, okay? For breakfast, she's gonna have bacon and eggs. Could it be fake bacon? It could well be, but it's not cereal and it's not toast. See what I'm saying? She could have bacon, she could have, for lunch, she could have boiled eggs and vegetables. Okay? There are ways around it. You're there for a short period of time, okay? Jack says, I haven't been sick in 12 years, and Jack is 30 years old. That's amazing, right? You know, it tells me something. You know what? You guys know about the germ theory and the terrain theory. I'm guessing that you probably know, and you might not know those terms, but basically the germ theory would say that the germs cause everything, okay? But where I have a problem is where, how come some people, like say Jack, is exposed to a germ, and the germ is supposed to cause the disease? Why doesn't Jack get sick from the virus or bacteria or virus or parasite or fungus? Why has Jack not been sick in 12 years? If germ theory was a thing, then everybody would have the same exposure and be sick with the exact same thing. So why do some people get it and some people don't? Is Jack's terrain different than the person who does get sick? Likely. So what would Jack say has made or helped him not be sick? And it's not, Jack mentions that he quit going to the doctor. Okay, well, not going to the doctor does not guarantee not being sick. You see what I'm saying? So is it maybe a little bit of both, that we need a little nidus, we need the germ, And then we also need to take into consideration the terrain. And maybe where we're having a problem or a disassociation is we're not talking about the terrain. Is that making sense? We're just talking about the germ, and we do everything to take care of the germ, which is the fix. You got high cholesterol, here's your medicine. You don't want to get a germ, here's your poke in the arm. You get a sniffle, here's your antibiotic. You get high blood pressure, here's your antihypertensive. That is what doctors in modern society have been taught. We learn a diagnosis, and then we have been taught how to treat the diagnosis. We learn that from the very first step into medical school. Our first class is pharmacology and anatomy. So we are learning from day one how to treat. And then we are incentivized by insurance companies. We're even incentivized by you to cultivate how we're going to treat you. You have been taught outside the medical society, outside the medical industry, by commercials and whatever it is, the radio. You've learned high cholesterol, for example, high cholesterol is the cause of heart disease. So you've learned that. Then you go to your doctor, and the doctor's also been taught that. So you guys are in coherence with you're in together. You say, oh yeah, we got this. Okay, so you go to the doctor, you get a diagnosis, then they give you the medicine, and now you are tied to the insurance company with a diagnosis and a medication, and they're gonna watch you like Big Brother for the rest of your life. If you go carnivore and you get rid of your blood pressure and you get rid of your diabetes, guess what? They're sending letters to your doctors. They're ratting on you. Dr. Jensen, I'm writing in with my concerns in regards to patient blah, blah, blah. They have a diagnosis of hyperlipidemia, and we noticed that they haven't filled their script in a year. They're monitoring you guys. Your insurance rates are going up. That's why all insurance rates are going up. Yeah, they're paying the CEOs $1 million a year. They're paying everybody $1 million a year. They're taking your money. You have a diagnosis. Your rates are going to go up. And you say, well, that's just life. Okay, maybe it is. I don't know. I'm just bringing it to your attention. Dial up. Do you have I don't know if you have a question. You're talking about being sick while traveling, with the dreaded, I still worked all day, 3-day total sickness with only 1 day I felt fever, a smoker. Well, dial up. I mean, you could change one thing. That would be it, right? No, I didn't know that. Dial-up is saying that we spent $4.9 trillion on healthcare in 2023, which I don't know the exact numbers, okay? The insurance companies skimmed 1.3 trillion off the top, pure profit. Did you know that? I did not. I did not. It doesn't surprise me, though. Oh, 1910, I'm glad you're here. Thanks for being here. And you can catch the very beginning of the live stream, another time. Vivian asks, can you please tell me your email address? I would like to request a list of lab tests so I can have consultation with you. Absolutely. It's IronLadyDoc, IronLadyDoc at AOL.com. AOL.com. So yeah, you can email me. I'll send you a list. Doesn't cost you anything to get a list sent to you, okay? It's free. If you want me to order your labs, just be aware that your insurance company, you'll have to use cash pay to the lab. I mean, it's just, they do not file insurance. That may be what we're moving to, and it might incentivize people to stay healthier, okay? Is having less coverage, and they've tried this, trying to make it catastrophic, that if you do go to the hospital, which is unbelievably expensive, like ungodly expensive. Why? Nobody knows, except for to make money, I guess. Who knows? I'm not going to speculate. Only you guys know. You've seen it. I've seen the bills. I'm sure you guys have seen the bills come in from the hospitals, and you go, what? You had surgery and it was $23,000 for a 2-hour surgery, and you went home afterward? Yeah. Yeah. Oh, Vivian says, please repeat. It's IronLadyDoc. Iron, I-R-O-N, lady, L-A-D-Y, doc, D-O-C, like doctor. So IronLadyDoc at AOL.com. Thank you. Boom, boom, boom. Let me see if I'm trying to see if I've missed any questions. I like that one, Geo. Geo calls me the buffoonery doc. So buffoonery buster doc, Geo. The buffoonery buster doc. Looks like Castro has joined. Thank you. Saying hello. Hello, Castro. Red Plant says, I have a black stripe on my thumb for 3 to 4 years. I have no idea what that is without looking at it. Sorry. Lucy says, my 2022 lab insulin level was 1. Now it's 4. Why would you think that would happen? I mean, it could just be the differences in the labs. It might have been a time of day when you got it done in 2022. It might have been at a low point in 2022. But Lucy, what's reassuring is it actually is up. So that means your pancreas is still working. Your beta cells are making insulin. And 4 is pretty normal. So maybe the 1 was really a 2 or whatnot. Or, you took it during a time when you were fasting and, at a certain time of the day, like maybe it was in the afternoon. I mean, who knows? There could be a lot of things. But be assured that at least you don't have a late onset, adult onset type 1 diabetes or a type 1.5 diabetes. So that's a good thing. Just keep rechecking it, Lucy. Your goal is somewhere between 3 and 5 or, 2 and 6, somewhere in there. Those are optimal values for your insulin level, fasting insulin, okay? You're very welcome, Vivian. Thanks for asking. It helps other people as well. Thank you. Yep, thank you, Lucy, for making that as a reminder. Starting March 1st, the consultation fees will be going up. I've had in fact, I had 6 people just this week scheduled because they didn't want to get in next month, which would have been a higher cost. So, yeah, Kashua, TriQuest Diagnostics for labs, they allow for self-pay. They do. If you want to, and the lab I use, Kashua, is a middleman. And then the middleman has a whole bunch of labs that you can choose in your zip code. So they might have a contract with all of the Quests and all of the LabCorps and all of the whatever labs there are out there, and they can get the prices down lower. So if Kashua goes to Quest Labs, Kashua might pay $300. But if I ran what Kashua wants as labs through my lab, they might have a better price. It might be $280. Well, you can save $20. That could put in your gas tank for gasoline. So I'm just here trying to save you some money. So if Kashua says, I can get those labs for $300, Doc, what can you get them for? And so I plug them in, I send you an email, and you'll get the price on that. And so you compare and you say, yeah, I'm going to the Quest Labs. I'm going through this place instead of this place. So you can go directly to Quest, or you can run them through my third-party middleman, and they have a better contract, and they can get them for $280 or $275, okay? That's just all, I'm just trying to save you guys money. If you don't care about the $20, just go do your thing online and don't worry about it. I don't know what the difference in price is. I could be $20 more, and then you are getting a better deal. And like I said, maybe you don't care. And that's fine too. I'm not here to spend your money or to save your money. Thank you, Kashua. You're worth every penny. Thank you. I appreciate that. Okay, I'm trying to read through. It's harder to find them on YouTube, the questions. So, okay. Faye says, I've been told my cholesterol numbers are perfect, but I have to take medication because the Diabetes Association states everyone diagnosed with diabetes must take a medication. I refuse to take it. Great point, Faye. There are guidelines that say that anybody who has diabetes will benefit from a statin. Do they tell you why you would benefit from taking a statin? Is it simply just a guideline? What is the reason for taking a statin? I can think of two. I can think of two reasons that a statin would be needed. Number one, it's anti-inflammatory. What causes inflammation in the arteries in a diabetic? Sugar, insulin. So is a statin warranted as an anti-inflammatory because you have diabetes? Yes, I guess by definition, yes. A statin also is antithrombotic, and that means a blood clot. So prevention. So statins help prevent blood clots. Do they do anything to prevent you from having a heart attack in other than those two reasons? Nope, there's never been a study that showed that. Do they lower cholesterol, which is carried in lipoproteins? So do they lower LDL? Yes. All LDL? Yes. Do they lower trigs? Not so much. Triglycerides. Do they lower HDL? Yeah, a little bit. But they're going to lower LDL. But is that the cause of your heart disease? So Faye has diabetes, the diagnosis of diabetes. What would block the inflammation and the high risk of having a blood clot rather than taking a statin? And the answer is get rid of the diabetes, right? Because diabetes, by definition, is carbohydrate toxicity. So to get rid of the diabetes, you get rid of the toxicity, which is carbohydrates, right? So instead of refusing a statin, why don't you refuse what caused you to have diabetes? Right? A lack of exercise didn't cause your diabetes. A lack of carbohydrate didn't cause your diabetes. Eating animals did not cause your diabetes. So use that fierce warrior, I refuse to take the statin, and say, I refuse to have diabetes, and so I must refuse the thing that caused the diabetes. Use your power and strength where it's going to work. Just you refusing the statin, well, you could be doing yourself a disservice if you continue to have diabetes, because you got a bunch of inflammation going on. Now, does the statin worsen your diabetes? Yep. Does the statin perhaps cause dementia? Yep. Does the statin cause problems with your muscles? Yep. Well, is that the reason you're going to refuse it? So you're going to refuse the statin, have the heart attack anyway, because you wanted to go against I'm not going to have that. They can keep their inflammation and keep their blood clots. I'm not going to take that statin, but yet I'll continue to eat the very thing that causes the number one cause of having a heart attack, which is diabetes. So I'm proud of you for standing up for yourself, but it might need to extend into what you're doing to yourself, not what the doctor is going to do to you. Okay? I'm not defending the doctors. I'm just telling you truth. And sometimes it's hard to hear truth. 1910 says it might be fun if you show us your grocery shopping list. It's pretty, I have a shopping list here, and I want you to try to guess who this is for. Buns, ground beef, steak, bagels, spaghetti sauce, pizza, soda, cottage cheese, water. Would you think that that is my grocery list? Likely not. Okay? My grocery list is ground beef, steak. I just found this new cheese. It's called Irish cheddar. It's grass-fed organic cheese. And I've been having a tiny little square almost every day. I just like the taste. It is real cheese. Right on, Penny. It's not my list, is it? Right on, Melanie. It is not my list. Yeah, my list is basically ground beef, steak of all kinds. I'll eat all kinds of steak. Skirt steak, flank steak. It doesn't matter with me and steak. I do get chicken because I feed the dogs some chicken. I try to get organic grass-fed chicken or pasture-raised chicken. They like pork. I don't eat much pork. We haven't had bacon for months. I just don't like to make it. I buy cottage cheese maybe a couple times a month. I eat, maybe a couple spoonfuls or tablespoons, I should say. The big spoonfuls before I go to bed. Casein protein stays with people longer than the whey protein. And cottage cheese is basically all casein protein. I do not have a problem with casomorphines. If you guys are wondering, I could eat 2 tablespoons and not eat the tub. Some of you eat 2 tablespoons and you do need to eat the tub. Yes, Lucy, it's my mom's list. I shop for her. And she knows I tell her every single day that these are bad foods. And she goes, just let me live. And I said, okay. And you let yourself die. That's up to you. Okay? We're all going to die. She just might speed it up. Or, you know what? She might not. But she is willing to gamble. And I get her what she wants. I'm not fighting anymore about that. She knows how I feel. She knows what I eat. She'll even ask me, what are you having for supper tonight? Because I say, I got to go home and make supper. What are you having for supper tonight? I said, eggs and hamburger. Wasn't that what you had earlier? Yes. And I said, you don't have to ask. It's some sort of meat and eggs. Oh, I forgot. I do buy some Organic Valley cream, heavy cream. And if I drink coffee, I put the cream in there. Or if I don't drink coffee, sometimes I'll just drink an ounce or a mouthful of cream. Not a big mouthful, but a little mouthful. 1910's interesting about the cottage cheese timeline. What about it? Timeline. Faye says, thank you. This year, I'm determined to get rid of the diabetes. Awesome. That she would ask after all these years. No surprises there. 1910, I'm missing I'm missing it. Is it true, once you're diagnosed with diabetes, lowering your A1C below 5 only puts you in remission as you are not able to cure diabetes? Well, I don't think that's true, Kashua. Diabetes is reversible. Diabetes, basically, let's just talk how you diagnose diabetes, okay? Most doctors diagnose diabetes by getting the A1C, the hemoglobin A1C. When that A1C goes over a certain level, for me, that certain level is 6.0. For other doctors or the American Diabetes Society or whatnot, we'll say 7.0. At 6.0, you have lost upwards to half of your beta cell function. Okay? Beta cells release insulin or secrete insulin. But let's go back to the A1C. That's how doctors diagnose diabetes. And they wait and they wait and they wait, and then it goes over a certain level, and they say, you have diabetes. What are we actually measuring when we get an A1C? Hemoglobin A1C is a blood test. It is measuring the amount of glycation, which is sugar binding to a protein. In this case, we are measuring hemoglobin. That is the protein. Hemoglobin is in a red blood cell. Okay? Anytime we have sugar in our bloodstream, it will glycate all proteins, not just hemoglobin protein. It'll glycate your skin proteins, which is collagen and elastin. It will glycate your eyeball proteins, your nose proteins, your lung proteins, your heart proteins. Everywhere there's a protein, sugar will glycate them. Glycation damages the cell. Boom, done, okay? Anytime glycation occurs, you gum up that cell. Glycation ages us. It causes oxidation in us, okay? We are aging from the inside out, even though you look at yourself in the mirror and think, no, it's on the outside in. No, it's not. The reason you look old on the outside is because your inside is old. So back to measuring A1C. When sugar, in this case, this hemoglobin A1C only measures glucose binding, glycating to hemoglobin. And then we get a diagnosis. So you know the lifespan of a red blood cell is about 120 days. So let's just say you got rid of all of your carbs, right? And you had an A1C of 7.0, and you waited 3-4 months. Now your level can be 5. Does that mean that you still have diabetes? No, because the diagnosis of diabetes is 6.0 or 7, whatever their cutoff is. So yes, you reversed your diabetes. It's no longer there. You took away the toxin, which was the carbs, the sugar. In this case, you're measuring glucose, but you didn't measure fructose or lactose or any other sugar. You just measured glucose. But to answer Kashua's question, the doctor who told her that, or the person who told her that, doesn't understand the concept of diabetes. If the person's, let's just give an example. What if Kashua's red blood cells were dying at 90 days and not 120? What's going to happen to the A1C? Will it be higher or lower? Will it be real? Will that level be real? The answer is it'll be lower, and no, it's not real. If your red blood cells are living 120 days, they're exposed to 120 days of glucose. If glucose is low, the exposure is low. The A1C will be low. If there's sugar exposure and the red blood cells are dying at 90 days instead of 120, they have less exposure to the glucose, so the A1C is going to be falsely low. All right? Let's see. I think that Lucy, my moderator, must have went away. So let me do a couple things over here on YouTube so we can clean things up. No, Lucy does seem to be here. Lucy, are you still here? Let me know. Just had a couple of things in here that 1910 says, I love when you talk about glycation. I've been eating so much sugar my whole life. Most of us have. Okay, thank you, Lucy. I appreciate it. Thank you for being here. I wasn't sure if you missed a couple of those comments, but I think maybe they were very derogatory, but not a problem. I got it taken care of. Okay. So Kashua, does that explain the interpretation by the American Diabetes Society would tell you that, hey, you're fine until you're 7. So the doctor can, all they have to do is follow guidelines. Follow the rules and you won't get sued. All right? But in the meantime, you're doing a patient the disservice. In fact, if Kashua was 80 years old, the doctor will tell Kashua that we don't want your A1C to be too low because that isn't healthy. They don't even really give a reason why. Like, why would an 80-year-old need to be at an A1C higher? Why would we okay an 80-year-old to experience more glycation than a 50-year-old? What is that? I'm not understanding the concept of having an elderly person at a higher A1C. What we're saying, oh, you know what? You're 80 years old. You don't really mean anything to us. Just keep doing what you're doing. Eat what you want. Don't worry about it. I don't get it, because you're a human, and we humans don't want diabetes is a disease. Why wouldn't you want to reverse it? So I never understood why they would tell my mom, oh, you know what? 6.5, that's not bad. You're okay. That's healthy. We don't want you too low. What? We don't want you too low. We want you to get rid of your diabetes, don't you? Oh, no, you can't get rid of diabetes. My mom has it brainwashed in her that diabetes is forever. What? Mom, you shouldn't eat carbs. Why? Because you have diabetes. Well, I'm always going to have diabetes. No, you don't have to have diabetes no, you don't. That's not true. I have it and I'm going to have it for the rest of my life. Well, you are, because you're eating crap, Ola. So, I don't know I'm not sure who sent me. Oh, it was Jackie. Jackie, thank you for the super sticker. Thank you. I appreciate that. That means a lot to me. That means something I said really triggered you and you go, I like what that doctor said. Thank you. I appreciate that. Oops, cancel. Kashua says, I love hearing how you break down the problem. I'm just trying to make it simple for you guys to understand. I really am. The A1C thing really bothers me. There's a lot of nuances to it. And another nuance that I tell you guys, and you know this, is hemoglobin A1C only measures glycated glucose. It does not measure glycated fructose. So if a person like Kashua was eating a whole bunch of fruit and she goes to the doctor and her A1C is 5.0, she will think she doesn't have diabetes because the A1C says 5.0, but it didn't measure the other sugar in her body. And I, being the doctor, might not even asked her, right? But how could I have figured it out another way? Glad you asked. I would look at her liver function. I would say, Kashua, I noticed your ALT and your AST are 25. Yeah, but doctor, isn't that in the normal range? No, it's in the normal reference range that they're giving you. But you have elevated liver enzymes. Why is that? Are you taking in Tylenol? Oh, no, doctor. I don't do any of that. I don't take anything supplements over the counter. I just eat food. Oh, Kashua, do you eat fruit? Yes, doctor, I do. Kashua, did you know that fruit can elevate liver enzymes and cause fatty liver? Well, no, doctor, I didn't. I didn't know that. I thought fruit was natural and we should just eat it. Well, our fruit today is basically like eating an M&M. It's juicy, it's full of glucose and fructose, but yet the hemoglobin A1C only measures glucose, glycation. So, doctor, how do I measure fructose glycation? I'm glad you asked. You could get a uric acid. You could get a fructosamine. You could get these things. I like to check uric acid levels because if uric acid level is high and I want to talk to you seriously about having a heart attack, I'm going to mention your uric acid level. If you want a surefire way of worsening your heart function, increasing your risk of congestive heart failure, AFib, coronary artery disease, a person with high uric acid level is going to be that person. You mean just from eating fruit? I said, well, that's one way, because if you eat fructose and uric acid are in a 1-to-1 ratio. If I see that your uric acid level is high, my first question is, do you eat fruit? Okay? Oscar, thank you so much for that super sticker. I appreciate it. But if you were to ask, really ask the doctor, what does hemoglobin A1C measure? Well, it measures your diabetes level. It measures glucose. Doctor, does it measure any other blood sugars, any other sugars in your body? I don't know. I'd feel hard pressed to think that other doctors know that hemoglobin A1C only measures glycated glucose. I don't think they're even remotely know it does not measure fructose. In fact, your doctor might not think that fructose is a problem. When, in fact, in order to metabolize fructose, you need to use much more ATP. You are wasting precious energy by metabolizing fructose. You are causing fructose to go directly to the liver and damage the liver. And people will say, yeah, but I'm not eating that much. It's okay. You don't have to defend yourself to me. It doesn't matter. I'm just giving you information. Fructose is metabolized by the liver only. It does not go through any of the glucose pathways. You make more, you actually use less ATP to metabolize glucose than you do fructose. But people don't understand. They've been told, brainwashed, cognitive dissonance, that fruit is good for you. And it is destroying your fructose and alcohol are metabolized the exact same way by the liver. You're causing fatty liver. And fatty liver could lead to cirrhosis. Well, fibrosis, then cirrhosis, then, death of liver. You could get cancer before then, liver cancer. All because they told you that fructose is good for you in the form of fruit. But they wouldn't even know that. I don't know if people really realize, doctors included, that there is a combination of glucose and fructose in fruit. And it used to be, let's just say 60-40, maybe, I don't know what the percentages is, but now the fructose to glucose ratios is getting more 50-50. So you're looking at an equal amount of glucose and fructose. And remember that during fructose conversion or metabolism, some is turning to glucose. You're right. And that could reflect in the A1C. But overall, you guys, a person who's eating a bunch of fruit on a daily basis that's not even in season, you're eating a seasonal thing all year long, you're just eating a bunch of sugar. You're just causing diabetes. And you say, I don't have diabetes? Well, you actually do. Get an insulin level, you'll see. Get a uric acid level, you'll see. It's scary what we don't know. And if I was being completely honest with you, this doctor talking to you right now probably didn't know that 5 years ago. I spent 22 years in practice and didn't know what I was actually measuring. That's not good, you guys, is it? It's not good. And so that is why I made it one of my passions, my goals, is to continue to learn and not be that ignorant doctor seeing 40 patients a day, following guidelines, and people just simply die. They die earlier than what is expected. And you know what the doctors say, and I never said this, but doctors will say, well, you've lived a good life. You're 75 years old, you've lived a good life. You mean if I die at 76, you would say, yeah, that's a good life. And really, everybody's just gonna die with diseases. Some just tolerate the disease better than others. I mean, what kind of a doctor says that to patients? I don't know. One that I guess doesn't really care. And then you look at that doctor, really look at them again, and you see what kind of life they live. And it's likely the same kind of life that their patients are living. 80% of the population is insulin resistant for whatever reason. Could be carbs, could be plastics in the air, could be diesel fumes, could be insulin, carbs, whatever it is, whatever the causes the insulin resistance. It's aging us. We're dying inside and out. You can slow it down. You have the capabilities. You just need the education. And that's why you're here every Saturday at 9 a.m. Central and every Sunday at 10 a.m. Central. Just maybe picking out one little tidbit like hemoglobin A1C. There's nothing you learned today except for hemoglobin A1C only measures glycated glucose, then you've learned something today. And you know that fruit is not picked up on the A1C. It doesn't pick it up. Fructose does not pick it up. It's not measured. You have to get a separate test to measure glycated fructose. Okay? That's the one tidbit you're going to walk away with today. I appreciate you too, Kashua. I really do. I appreciate all of you guys for being here. Why am I not slowing down on your aging? Everybody's aging. Is that a question? You obviously, do you know me? I'm not sure. Do I know you? Try less ego. Try less ego. Is that an ego part of you that's asking me why I'm not slowing down on my aging? Explain try less ego. That's using, looks like ego to use a fallacy argument on me. We're all aging. I don't know. Moderator, do we have an answer to that? Try less ego? Interesting, right? Instagrammers? That's their handle, try less ego, as they ask me, why are you not slowing your aging down? Is that like saying your aging is going faster? Isn't that what that's saying? So try less ego might need to change their handle. Try more ego. Thank you, Rosie. Thanks for being here. Hello. All right, you guys. We will call it quits today. I will be back, Lord willing. I saw a post here. Okay. You guys. All right. Here we go. Tomorrow, Lord willing, I'll be back at 10 a.m. Central. Join on either YouTube or Instagram, both at IronLadyDoc. Like, subscribe, do the clickety-clack for me. It really helps. Thank you to those who did the super chats and the super stickers. It means a lot to me. And check out the description for all of my links and all of that, you guys. So have a beautiful Saturday. And I have a tallow right here. You can't see him, but, well, maybe you can see his ear. There's his nose. You saw his nose. Tallow is ready to do the outdoor thing, and he comes and tells me. He's such a good boy. The other, they're all good, but he's getting better at telling me. So that's a good thing. So you guys have a wonderful day. All right. See ya. Oh, I can't push the off button. Get out of there. There we go. See you guys. See you YouTubers.